students, consultants, and faculty for this workshop on colposcopy. Every one of you already know how colposcopy is, what are the uses, indications, and benefits of colposcopy, and how to prevent or diagnose early of the common cancers of the women. The most important aspect of preventive oncology is diagnosing early whenever they come for some other cause and create awareness amongst the women who are supposed to be backbones of the families. Once we create awareness, probably partly we cover in primary prevention also. When they miss primary prevention, which is not mostly not in their hands, the secondary prevention, which is either diagnosing early and also intervene when the cancer is not fully developed, that is pre-cancer stage. Now, even identifying HPV in cervical cancers. HPV, now you know that, which is given a lot of importance because it is closely associated as it is identified along with the almost 80% plus cases. HPV is identified in all the specimens. In our context of India, when the population explosion is seen with the 1.4 billion population, the cancer also is growing with about 1.5 million every year have been identified. Amongst the women, breast of course is becoming more common, superseding cervical cancer. When cervical cancer was the commonest, at least in South India about 20 years ago, now even in South India, breast cancer is becoming more common. In earlier days, the cervical cancers have been identified with malnutrition, genital hygiene, and subclinical infections. But with more and more technologies, HPV is identified as the major cause for cervical cancers. I thank Dr. Leela, who has taken initiative in conducting many workshops to educate more and more young gynecologists so that the gynecologists have to take more initiative to spread across to reach the society. The objective is that one is to prevent in primary and also to involve and intervene in secondary prevention. These two are most important. Of course, the tertiary prevention is usually to slow down the process of the disease by further intervention that usually will be done by oncologists. The faculty who are involved in this workshop, all of them are well experienced, have seen several thousands of cases, and also they know the natural progression of the disease. So in every stage, these type of workshops, we will learn more and more by interactive sessions than didactic lectures. I request all the gynecologists and also young gynecologists to interact, to make it more lively program, to learn more, and also some of the doubts in the form of question and answer sessions to make it more lively. I wish you all the best and success of this workshop, and also thank all the faculty to accept and also conducting this program. Thank you very much.